Hey guys, guess what? It's Angel. You're watching my latest video. Today's video is going to be quite different from the other videos I've made in the past, dealing with more of a serious subject today, and I've been wanting to make these videos, a series of videos for quite a while, but as much as I want to make them, I'm also hesitant to make them because there are a lot of people that will watch this video that don't know me on a personal level, but there are some people that will watch it that do know me on a personal level that don't know that I've kept this secret from. And my purpose in making this video is I'm hoping that it will help someone that deals with my same illness. Because it's quite a lot to swallow when you get the diagnosis. And I'm just going to jump right into it. I have not scripted this, and I'm not really sure where I'm going with these videos, but I really do want to talk about this because there is a huge stigma that comes with mental illness, and I am hoping to help remove that stigma. So here we go. In February of 2012, I went to my doctor. I had been seeing a counselor. I had been dealing with depression for many years. Had been in counseling for a good 18 years, and was being treated for anxiety disorder. Basically, I was being treated for social anxiety disorder, panic disorder, and depression. And my doctor had put me on the medication Cymbalta. I had been on that for about a year, and slowly my doctor had increased the dosage up into the point where I was at the maximum prescribed dose because I still was not getting relief from my depression symptoms. Once I was on the maximum prescribed dose, I started having symptoms of hypomania. And if you don't know what hypomania is, it's basically this, on the mood spectrum, it would be like the highest mood that you could be at, where you feel like you are super smart and you have tons and tons of amazing ideas, things you want to do that you feel like you're capable of doing. For instance, starting a new business, moving to a new state. An example, at the time, my son was on the swim team, and he was really, the swim team as a whole was doing really well. My son was doing really well, and he lettered in swimming, and he had expressed, an interest in, at the time the Olympics was going on, Michael Phelps was really big, and my son was a teenager, and he was like, it would be cool if I could train to go to the Olympics. So, in hypomanic state, you have these thoughts of grandeur. So, my son had mentioned that he would be interested in training to try and qualify to go to the Olympics. So I began telling people that my son wants to train to qualify to go to the Olympics, and I really believed that this was going to happen, which, it could happen, but what are the chances of it happening? It would take a lot of work, hard work and dedication, and it would take full focus, and so it could possibly happen, but the chances are really slim that it will happen. But in my mind, in the hypomanic state, it was going to happen, and I was convinced of it, and so I went to my doctor, and it was just a regular checkup, and I started telling her about all of these amazing ideas I was having, and just incredible energy I was experiencing. And when I started talking to her about all of these things, she said, okay, those are great, but she said, I think that we need to change your diagnosis. And at that point, she diagnosed me with bipolar 2 disorder. She already knew, we were full aware that I was having really low lows but I never really talked to her about the highs I had had, because you don't generally go to the doctor when you're feeling really good. And so generally I would only go make appointments to see her, my prescribing doctor, when I was having bouts of depression. And this just happened to be a regular checkup that I went to that I was on this high. And so we talked a little bit more about how often I was having these highs. And basically, she gave me the diagnosis of bipolar 2. She showed me a list of symptoms. When I got the list of symptoms, I got really emotional because my whole life I had experienced these highs and these lows, but I never really, I don't think I ever really recognized when I was on a high or when I definitely recognized when I was on a low, but I never recognized the highs. I recognized spontaneous decisions in my life. I recognized times when I would do sort of out of the ordinary things. And so just a really quick example that I will give as far as out of the ordinary things when I was on a high. There was an evening that it was, I had put my son to bed. He was like 12 or 13 years old at the time, maybe 14, I can't remember. Put him to bed. I was sitting in my living room and a commercial came on TV for paint. It was like a Bear commercial or something. And these people were painting a room in their house. And so it's 9 o'clock at night. I see this commercial and I get this idea, I'm going to paint my office. So I get in my car, drive to Walmart because they were 24 hours, you know, they're open 24 hours. So I drive to Walmart, look at the paint swatches. I pick out a color that I think I will like for my office. I call someone over, they mix the paint for me. I go home, I tape off the room. This is all in one evening, mind you. You know, this is probably about midnight at this point that I get the room taped off. And I start painting, and I paint a full coat. I paint the whole room, a full coat. And then I decide, you know what? I have enough energy. I'm going to paint a second coat. So I do that. We're well into the early morning by this time. And so I paint the second coat. Then I decide, you know what, I cannot go to bed until this room is put back together. So I pull all the tape off the room and I vacuum, you know, around the baseboards, and I vacuum the carpet, and I move all the furniture back from the center of the room back to where it goes. And I put the room back together. And then I go to bed and I sleep for maybe like an hour, and then it's time to get up and get my son off to school. So I do that, and then I continue on with my day. And I would have out of the ordinary things like that happen from time to time. But it didn't dawn on me that that wasn't normal. So, so I get the diagnosis February of 2012 that I have bipolar 2 disorder. And then the next thing that I'm told is, don't tell anybody about it, because people don't understand bipolar. They don't understand mental illness, and you could lose friends if you tell people. So that's a lot to take in initially. I didn't understand what it was, but I looked at the list of symptoms. I could identify with almost all of the symptoms. I mean, I think there was only one symptom there that I didn't identify with. She took me off the Cymbalta immediately, put me onto a medication called Saffras. She explained to me that this was a new medication. It was fell into the class of antipsychotics. When you hear that you're being put on an antipsychotic, for me, immediately I thought, okay, so have I been psychotic at some point? But my doctor assured me, no, you've not had any type of psychosis. But we treat bipolar oftentimes with antipsychotics, is what she explained to me. This was a new drug that had just come out called Saffras, and it was a sublingual tablet. So she explained to me, you know, we're going to start you off at a small dose. This tablet, you cannot you know, cut it in half, but don't touch it with your fingers, because as soon as the oil from your fingers touches it, the pill will start to disintegrate. So cut it in half, you know, use something to put it on your tongue. It'll dissolve immediately, and that's the way you take the medication. So that was my introduction to bipolar 2 disorder. And if you don't know what bipolar 2 is, basically bipolar disorder is people that have extreme high highs and then extreme low lows. So they get manic and then they get really, really depressed. Bipolar 2 disorder is your highs are high, but they're not mania. They're more what's classified as hypomania. And I can explain that a little bit more later. And then you have hypomanic episodes, and then you will crash and you will have depressive episodes. And so that is what I was diagnosed with. And with bipolar 2, you actually have more depressive episodes than you do high episodes. And I could certainly relate to that, because I had been treated for a long time I had been treated for my depression. And so I immediately went home, told my husband, showed him the list of symptoms. He looked at the list of symptoms and he said, "This describes you to a T." And I got emotional. You know, you never want to get that diagnosis. You never want to be told that you have a mental illness. Mostly because you're afraid of what people will think if they find out, when they find out. Because I had worked with a girl a few years back when I worked for Barnes & Noble. I had worked with a girl that suffered from schizophrenia. And when she told me that she suffered from schizophrenia, we were at the break. We were in the break room. We were sitting at the table, and she told me she suffered from it. And I'm ashamed to say this now, but at the time that she told me that she suffered from schizophrenia, I immediately became somewhat afraid of her. Because I didn't understand, you know, and I still honestly don't really understand schizophrenia. But there's that stigma that comes with someone telling you that they suffer from bipolar or schizophrenia. The only thing that I knew about bipolar, immediately when I got that diagnosis, I immediately thought of Mary Kay Letourneau. And if you don't know about Mary Kay Letourneau, she was a school teacher who had an affair with a 5th grade student who suffered from bipolar. She ended up going to prison for it. Once she got out of prison, she ended up marrying the student that she had had sexual relations with when he was in 5th grade. And the only other things that I had heard about people with bipolar was like different school shootings that had happened, and on the news they would say, oh, the shooter suffered from bipolar, and that's what I knew about it. And so I was really scared about. I knew I had never suffered from a psychosis, but I definitely knew that I had had hypomanic episodes, and that I had suffered from low lows for a great period of my life, and I still deal with really bad depression, and I can address that later on in another video. But so the next thing that I did after I talked to my husband is I went online and I went on YouTube to look for videos I just typed in bipolar disorder, and it pulled up a few like different videos. There was a documentary, and I watched all of those because I was trying desperately to hear other people's stories, so that in hearing other people's stories, it made me feel like I wasn't alone, that other people suffered from this, and that they were living with it, and that they were having normal lives with it, or as normal as they could possibly have. A counselor doesn't like for me to use the word normal because everybody's normal is different, so there were videos on YouTube, but there weren't as many as I really craved at the time. And so I didn't want to talk about it immediately. You know, for the first year, I was very, very secretive about it. In fact, I didn't even tell all of my family. Like, I only told like certain members of my family that I had gotten the diagnosis. And then by the second year, so I was diagnosed in February of 2012. And by November of 2013, I had my first hospital stay. And that's a whole other video, which I will make and I will share. So that was 2 years into my illness. And at this point, as of February of this year, I'm 3 years into my diagnosis. Now, I'm not saying that I've only had bipolar for 3 years. I've had bipolar for most of my life. But I only got the diagnosis 3 years ago. And I've only been treated for it for the last 3 years. So in this series of videos, I'm going to talk about my initial treatment. I'm going to talk about all of the different medications that I've been on, the good medications and the bad medications, because some work and some don't. And honestly, you're a guinea pig. Because every medication works differently for everyone. And there are some medications, all antidepressants and different antipsychotics or whatever you want to talk about, they all come with a red label, I believe, warning, saying they can cause suicidal thoughts or tendencies. And those warnings are there for a reason, because it happens. And it happened to me, and I'm going to talk about that. But I want to make these videos for anyone out there that's got the diagnosis. Maybe you just got it. Maybe you've had it for 20 years. You know, whatever. But I want you to know that you're not alone, and that you can live with it, and you can have a balanced life with the right treatment and the right medications. And you have to educate yourself, and sometimes you have to educate your family. And so that's what I really hope that these videos will do, is they will make people feel more at peace with what they're dealing with, because it's a tough illness to deal with. Mental illness, no matter what, if it's bipolar, if it's schizophrenia, if it's depression, if it's, you know, whatever type of mental illness, it is a disease. It's a disease of the brain. It requires medication. You can't think your way out of it. You can't wake up and say, I'm going to be positive, and you can't exercise your way out of it. You can't, if you have diabetes, you have to take your insulin to control your diabetes. That's just the way it is. It's a disease. This is also a disease. A lot of people that have this don't want to take their medication because the medication comes with so many side effects, and we're going to talk about that. But you have to be medicated. You have to stick it out. Talk to your doctor, explain to them what you're feeling on different medications, find that right combination of medications for you. And once you do, you're going to feel as well as you possibly can. And it's important. Medication is life-saving. Tons of people that have bipolar take their lives every year. Suicide is a huge risk with bipolar, as well as depression. I don't know that much about schizophrenia, so I really can't talk about that. But I really hope that these videos will help people. So this is just the start. We're going to continue the conversation. Please, in the comments below, if you have questions, tag me, ask the question, and I'll answer the questions if I can in the videos. And hopefully we can take this journey together, and we can remove some of the stigma that comes with mental illness. And if you don't suffer from it, you may have a friend that suffers from it. You may have a family member that suffers from it. And maybe you can help them. Maybe this can help them. I don't know. That's my hope. And so for now, I'm going to close this video and be looking for the next one. And yeah, hope you guys are having a good day. I hope that this helps somebody, and yeah, until the next time, I'll talk to you later. Bye.